So first, I do want to tell you a little bit about Triage Cancer and what our organization does. So Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And we provide this free education in many different ways, whether it's through our educational events like our Triage Cancer Conference. We also do a monthly webinar series. We also have a ton of written resources like our quick guides and checklists, which provide a really good overview of some very important topics. And we also have a lot of state-specific resources because when it comes to law, where you live matters. But you can access all of these resources for free through our website, triagecancer.org. So to put today's presentation in a little bit of context for us, I wanted to first talk about what is financial toxicity. And financial toxicity is a term that was coined by some researchers at Duke in 2013. And it is used to describe the financial burden of a cancer diagnosis. But even though we've been talking about financial toxicity for more than a decade now, the reason that it has been so hard to solve is that there are a lot of contributing factors to financial toxicity, and really there isn't a one-size-fits-all solution. However, we at Triage Cancer really do think that health insurance status is the number one contributing factor. And that isn't just about, whether someone actually has insurance or not, but it's also about, does somebody have adequate insurance for them? And are they effectively navigating these policies? Certainly, though, employment changes can occur after cancer diagnosis, and that can definitely impact finances. And then also there's all other sorts of things that happen in life that normally impact finances, like relationship changes or moving. And those life changes continue to happen, and they really do compound the financial impact that someone is experiencing after a cancer diagnosis. So in order to effectively address financial toxicity, all or at least most of these issues need to be addressed. But today we are really going to focus on how to effectively navigate health insurance, and I will also touch on disability insurance at the end too. So I just said that we think that health insurance status is a primary contributing factor to financial toxicity. So that's actually really pretty easy for us to solve. However, the problem is health insurance is so complicated that us as Americans simply do not understand how it works or how to choose a plan that's going to work best for us. In fact, only 4% of people surveyed could actually define the terms used in a policy. And one of the reasons that finding the right health insurance can be so challenging is that to be a truly informed consumer, you essentially have to learn a whole new language. And we know from multiple studies out there that Americans just don't understand health insurance. And we have a ton of data that tells us that the average American really doesn't understand how health insurance works or even how to choose between their options that they have. And when we talk about financial toxicity and navigating the system, understanding the basics is really step one. So to that end, starting at the very beginning of our building blocks, I do want to talk about the terms that are most often used and frequently misunderstood in a health insurance policy so that we could have a good first building step before we talk about next steps. So these are the terms that we think are most important for everybody to understand about their own insurance coverage, regardless of where they're getting their health insurance. So first, I want to talk about the premium, which is the cost that you pay each month just to have health insurance. So even if you never go and get medical care during the year, you would still have to pay this monthly premium. But then there are costs that we pay when we go and get certain types of care. So first, we have to pay our annual deductible, which is a fixed dollar amount that we have to pay out of pocket first before insurance even kicks in and starts to pay for any portion of our medical expenses. So you could have a $500 deductible, you could have a $5,000 deductible, maybe even a $0 deductible. Again, it's going to depend on the type of policy that you have. And then there is something called a copayment, and this is also a fixed dollar amount that you pay when you get certain types of care. So I like to kind of think of it as an entrance fee because you're typically going to pay this right when you go to whatever office you are going to. So if you're going to go and see your primary care physician, you might have a $10 copayment, but maybe you're going to go see a specialist and you have a $30 copayment. These amounts are going to depend on the type of coverage that you have. And then I want to talk about the coinsurance or the cost share. And these are two terms that are used the same way, but it is the difference between what our insurance company pays for our medical expenses and what we are going to pay for our medical expenses. So let's say we have a plan that is considered an 80-20 plan. This means that our insurance is going to pay 80% of our medical expenses, and we are going to be responsible for that last 20% of our medical expenses. And then lastly, there is the out-of-pocket maximum, which we would argue is probably the most important thing that anyone should know about their policy, because in a worst case scenario, this is the most you're going to pay out of pocket for your medical expenses during the year. This is another fixed dollar amount, but the amount is going to depend on the type of coverage you have. So you could have a $1,000 out-of-pocket maximum, or maybe you have a $20,000 out-of-pocket maximum. And the way that you reach your out-of-pocket maximum is that you add up what you've already paid towards your deductible, plus any co-payments that you've made during the year, plus any co-insurance amounts that you've paid during the year as well. And then when you reach your out-of-pocket maximum, your insurance is going to kick in and it's going to pick up the rest of your medical expenses at 100% for the rest of the year. Because out-of-pocket maximums are so important, I do want to walk through an example of how they actually work. So I want you to meet Dan, and Dan has a policy that has a $2,000 deductible. It is an 80-20 plan, and he has an $8,000 out-of-pocket maximum. He unfortunately had an accident and he had to spend a week in the hospital, and he ends up walking out of the hospital with a $102,000 hospital bill. So let's assume that he has no other medical expenses during the year. How much is Dan actually going to have to pay for his medical bill? And it is actually really helpful to kind of walk through the math on this. So I'm going to go through all of the different steps. So first, he has to pay his $2,000 deductible, which is going to leave him $100,000 left of that bill. But remember, he has that 80-20 plan. So he's going to be responsible for $20,000 of the rest of that bill because that's 20% of the $100,000. But he has that out-of-pocket maximum. And since he's already paid his $2,000 deductible, he actually only has to pay another $6,000 of that $20,000 bill. And then he'll have reached his $8,000 out-of-pocket maximum, and his insurance will kick in and it will pick up the rest of that $20,000 bill. Now, I'm definitely not suggesting that $8,000 isn't a lot of money, but it is better than that $20,000 he would have had to pay if there was no out-of-pocket maximum, or even if that bill that he started out with, that $102,000. So again, it allows you to kind of plan for the worst case scenario, knowing that that is the most that you're going to pay out of pocket for the year. I do want to say if you'd like to watch this example again, we do have a couple animated videos on our website, and this is included in our animated video on health insurance basics. Just continuing a little bit with the out-of-pocket maximum, because with out-of-pocket maximums, the devil is kind of in the details with it, as not all health insurances calculate their out-of-pocket maximums the same. For example, if you go and pick out a health insurance plan through the marketplace, those plans have to include the deductible, the co-payments, and the co-insurance amounts, both for your medical care and your prescription drug coverage, all towards your out-of-pocket maximum. However, with a lot of employer-sponsored plans, they might separate out any prescription drug coverage that has been paid for its own separate the prescription drug costs into its own out-of-pocket maximum. So maybe your medical expenses have one out-of-pocket maximum, but then your prescription drugs have another out-of-pocket maximum. And for example, with Medicare, If you have original Medicare, any prescription drugs that you are taking, that's going to be counted towards your plan or your Part D prescription drug coverage. So that's not going to be included in any other out-of-pocket maximum. So really the key here, though, that I'm just wanted to make sure that we understand is that what the specific plan counts towards the out-of-pocket maximum is going to depend on that specific plan. And it is really important to know that so that we can plan for the future cost for that year. So this was a really brief overview on health insurance basics, but we do have a wide variety of resources on our website about different types of health insurance options, how to compare those options, and also how to use insurance effectively. But I do want to go over some other points on how to effectively navigate our health insurance. So it is also really important when we're trying to find effective health insurance for us is to know all of the options out there that we have. And in the United States, there's actually only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, or maybe we were getting it through some type of government health insurance plan. And by that, I mean like Medicare, Medicaid, military veterans plans. But about 50% of the people in the United States still get health insurance coverage through their employer. And there may be a time where we actually have multiple options for health insurance. And it's really important to know how to compare these options so we are picking the most effective plan for us. So I do want to walk a little bit through an exercise of how to compare these plan options, specifically when it comes to the costs. And the example I'm going to go through, I'm specifically going to use options that I gathered through the marketplace, but this is going to be useful if you're comparing any other types of health insurance. So maybe you're comparing 2 employer options. Maybe you are using it to compare your Medicare plan choices. All of these different types of health insurance options can be used when we're comparing them through this next example. So again, we have 3 plans that are available to an individual through the marketplace. There is a bronze plan at $200 a month with an $8,000 out-of-pocket maximum. There is a silver level plan at $275 a month with a $6,000 out-of-pocket maximum. And we have a platinum level plan at $400 a month with a $2,000 out-of-pocket maximum. So we are going to assume that we're going to hit our out-of-pocket maximum during the year because when we're talking about the cost of cancer care, the likelihood is pretty high of that happening. And so just looking at these plans, can we actually tell us which one is going to be the most cost effective for us by the end of the year? Meaning which option will actually end up costing us the least? And that question is not a trick question. The answer is actually on the slide. You can't just tell by looking at them. You actually have to do some math. And the way that you do the math is that you take the monthly premium and you multiply it by 12 because that's how much it's going to cost you to have the plan for the year, no matter what. And then we're going to add to that our out-of-pocket maximum because, again, that is the most that we're going to pay out of pocket for medical expenses during the year. So in this example, it actually turns out that that platinum level plan ends up saving someone almost $2,000 over the course of the year. Even though we really do kind of get a sticker shock when we see that monthly premium and it seems so much more expensive, but that's mostly because we don't understand how our out-of-pocket maximums work and we kind of always jump to what's going to cost us the least at this exact moment each month. But we really do need to take into consideration the monthly premium and the out-of-pocket maximum when we're shopping for health insurance coverage and comparing these options that we have. So doing the math is extremely important, but it isn't just about cost. We actually have to look at some other things that we need to pay attention to. So we definitely need to make sure that our plan is actually covering the providers that we're going and seeing. And by providers, I mean the facilities that we're going to, maybe any cancer centers we're going to, including the labs that our blood work is getting done at. We all need to make sure that that is considered in network for our plan. And we also want to make sure that the prescription drugs that we are taking are also covered. And I realize that this might sound obvious, but we often have calls with individuals who don't think about that at the first moment when they're choosing their health insurance. They're just thinking about the cost of just having that plan, and it actually ends up costing them more in the end, or creating at least a little bit of frustration when they realize that the providers that they're wanting to go and see are no longer covered by their health insurance. So this is a lot of information about just understanding health insurance and picking a health insurance plan, but we do have a lot of resources on these. We even have a health insurance comparison worksheet that can help do the math for you. And we also have one specifically for Medicare plans too that can help if you're deciding between 2 prescription drug plans or even different Medicare Advantage plans as well. The reality is, though, that even after we are able to get an adequate health insurance for us, this isn't going to completely eliminate medical bills. And we often see people who are like this guy in this little animation that's chatting with his friend who's saying, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. And while this is an interesting coping strategy, this is not one that we would necessarily recommend, but there are a few things that we can do to help reduce the burden of medical bills. And this isn't even necessarily just during one's initial active cancer treatment, but also it could be utilized during any surveillance or follow-up care. Plus, it's also just helpful tips for any of us as consumers as we are going and getting any healthcare. So once you do receive care, you are going to receive medical bills, and you're also going to get a lot of different correspondence. Just from the insurance company, you could get 3 different pieces of mail. One saying that they have received a claim, one saying that they're processing your claim, and then also one called an explanation of benefits, also sometimes referred to as an EOB. And these EOBs are a little bit challenging to decipher, but they're going to give you an idea of how much you're actually going to have to pay out of pocket for that specific medical claim. And because they are a little bit challenging to decipher, I do want to walk through an example of an EOB. Unfortunately, every insurance company is going to present this information in a slightly different way, but they generally should all have this minimum level of information. So the first telltale sign on an EOB is that somewhere on the form is going to appear the words, "This is not a bill." This is going to let you know that this is the EOB and not the actual medical bill. You also see some information about the policy holder and who the claim is for. You also get some sort of summary of the claim. And then in this chart, you're going to see some more information about the actual service. So the date of service, a description, possibly a CPT code. You're going to see information about the amount billed and the amount not covered. And this amount not covered is sometimes about the difference between what the provider billed and what the insurance company has contracted with them to pay for certain services. And then in this last column, it's going to show your coinsurance amount and what someone is likely to owe their provider. Lastly, you also see some information about how much you've paid towards your deductible for the year and how much you have paid that has been applied to your out-of-pocket maximum, both for an individual and also for your family if you have a family plan. So we are not done with the paperwork you will receive. You are also going to get a bill directly from your provider. This could be from the hospital where you get care, from your doctor's office, or even from a lab company. But really the challenging part with all of these pieces of communication from the insurance company and the provider is that they may not be sent in the same way. Like some might be sent physically in the mail, sometimes it's by email, sometimes you only get access to them through your patient portal. Another challenging bit is that they don't always come in the exact order that we've just been talking about them in. Many providers are in fact faster than the insurance company at sending the bill than the insurance company is at processing the claim. So it is really important to keep track of all these pieces of communication and to make sure that you are waiting to pay any bills before you're able to compare the medical bill with the EOB. So then you can see if there's any discrepancies in the bill and the EOB. You can have the opportunity to ask any questions. You would also be able to see if the insurance company denied any of the claims that were submitted. And that would give us the opportunity to appeal any denials that you might have received. So I'm asking you to keep track of a lot of things, and this can be a little difficult to do, which is why I just want to mention that Triage Cancer actually has a medical bill tracker form to help you keep track of all your medical bills. And just to show you a little bit of how it works, on the top of the plan, on the top of the tracker sheet, you can put information about your insurance plan that you have. You can put in information about the deductible amount and your out-of-pocket maximum. And then as you start to receive medical bills, you just start to input that information, and the sheet itself will automatically track how much is going towards your deductible and your out-of-pocket maximum. So this can be helpful if you are receiving all different sorts of communications and you want it all in just one place. And this can also be found on our website, triagecancer.org. Now, if you are in a situation where you do owe a healthcare provider, we do suggest to talk with them. We do suggest doing this before they turn over your unpaid bills to collection agencies. But if you can't make a payment, you can always ask for more time. You could check to see if they'd be willing to negotiate a payment plan or maybe even accept a lower lump sum payment. We always try to remember the motto here with it can't hurt to try. They are usually very willing to at least work with you, and that's why we say it's just best to try and talk with your providers if you do owe them and are having a hard time paying them. And even if someone has been doing all of the steps that I've been suggesting and are able to choose an adequate health insurance plan for them, there's likely going to come a time when your health insurance company denies a claim. And we really want everyone to know that you do not have to take this initial denial as the final answer. Generally, as consumers, we actually have two rights or two opportunities to appeal that decision. The first is by doing an internal appeal, which is where you go back to the insurance company and ask them to reconsider their decision. You can provide more information to them, work with your healthcare team to submit that extra evidence, and hopefully the insurance company will change their decision and actually approve that claim. However, if they are still denying that claim, you actually have another opportunity called an external appeal. And this is where we're going to an outside independent third party to review our claim to see if the health insurance company should actually cover it. And what's really great about this external review process is that whatever the external review decides, that is binding on the health insurance company. So that external review process says that the insurance company should have covered that claim. Your health insurance company then has to cover that claim. And I completely understand that I'm just telling you more things to do, basically, when you already have so many other steps that you have to do. But we have a lot of data out there that tells us somewhere between 40 and 60% of all claims that get appealed are actually decided in favor of the patient. So that is telling us that insurance companies are getting it wrong about 50% of the time. So this appeal system is actually incredibly valuable. But the problem is that consumers rarely ever appeal their actual denied claims. I believe it's more than 99.8% of all denied claims never get appealed. And when we're talking about access to care and financial toxicity, this is a hugely underutilized tool that we have in our toolbox. And another hurdle is that, again, I'm asking you to do more things, and it's a lot of stuff to keep track of. And you are talking about paperwork, you're talking about phone calls, conversations with a bunch of different people. And so it can be really hard to stay organized with all this information and making sure that everything is being documented. And this is a great time to utilize the support of family and friends. Maybe they can help keep track of any deadlines, of any paperwork. We even have an appeals tracking form to help keep track of all the different deadlines that come with the appeals process. It can help keep track of noting who you're talking to during the appeals process. So there are some resources out there to help you. And I want to just point out that we have a ton of resources on health insurance appeals, whether it's quick guides, we have information on all the different appeals processes for the different types of health insurance that are out there. We are also happy to speak with you at any point if you ever have any questions about the appeals process as well. So that's my long-winded but brief overview of health insurance. So I do want to just quickly go over some details about disability insurance. And so that means that I want to just talk a little bit about the different disability insurance options that might be available to someone. So there's actually a lot of different types of disability insurance coverage. So there is private disability insurance that can be bought directly from an insurance company, or it can be accessed as an employee benefit that your employer gives you. And I cannot tell you the number of people that we have talked to over the years who thought that they didn't have access to disability insurance through their employer. And we actually told them to go back and look through their employee manual, and it turned out that they actually did have disability insurance coverage. They just completely forgot about it because sometimes it's just a piece of paper you sign on your first day of work and your employer pays your premiums and you just never even think about it. So if you're unsure if you have access to disability insurance through your work, I 100% recommend going back to your employee manual or maybe even asking HR if you have this benefit available to you. There are different types of private disability insurance, so it can be either short-term or long-term. Short-term disability plans typically last up to a year, whereas long-term disability plans typically last a year or longer. So this might be an option for someone, but there are also two federal disability insurance programs. Both are administered by the Social Security Administration, or SSA, and these are called Social Security Disability Insurance, or SSDI, and Supplemental Security Income, SSI. Both of these two plans are considered long-term disability insurance programs. They do have different requirements and different benefits, but both of them are going to have the same very high standard of disability. So the Social Security Administration defines disability as a medical condition that is expected to last 1 year or longer, but it keeps you from working, and not just from your current job, but also any job that you've had for the last 15 years. So we, and probably a lot of other people, consider this to be a very high standard of disability. And also a very common question that we get about applying for disability benefits is, can I apply for Social Security disability benefits while I am still working? And the answer is, it very much depends, which is an unfortunate answer to provide. But the reason it depends is that there is a step-by-step sequential process that the Social Security Administration goes through to decide whether or not someone qualifies for these benefits. And what is the first question? Are you working and earning more than $1,620 per month? If that is a yes, then you are working according to the Social Security Administration, and they're going to automatically kick you out of the application process. But if you are earning under $1,620 a month, as far as the Social Security Administration is concerned, you are not working. So every year, the Social Security Administration determines a threshold, a monetary threshold, and that threshold determines whether or not they think you are engaging in substantial gainful activity, or SGA. So in 2025, that number is $1,620 a month. And if you are earning more than that, they are going to consider you to be engaging in substantial gainful activity. But if you are below that, you are going to go on to the next questions. And the next questions are going to be about your medical condition and then whether or not you can actually work. So after determining whether you are working, they will go on to these next 4 questions to see if your medical condition is severe enough, is your medical condition on a list of impairments, and can you do your current job or any other jobs. So that's what the sequential determination process is like. So really, that's what's the same about the 2 programs. There are actually a lot of other differences between SSI and SSDI. And SSI is based on your low income and low resource level, and that you have a disability. So in most states, when you qualify for SSI, you're actually going to automatically qualify for the federal government health insurance called Medicaid. And so that's also a great option if you're able to get health insurance that way. But everyone across the country, if you get approved for SSI benefits, you could get the federal maximum amount of $967 a month from SSI. And we understand that that is not a huge amount of money, but I wanted to bring up SSI because the application process for Social Security disability benefits can actually take a really long time to process, or before you even hear back from the Social Security Administration. So this is a potential opportunity for you to get some benefits while you are potentially waiting for Social Security disability benefits, or even to cover what is called the 5-month waiting period that comes along with SSDI. And I will talk about that in a second. But to talk about SSDI, this is not a program that someone is eligible for based on income level. It is based on your work history and whether you have paid into the Social Security retirement system and that you've been paid into it recently. And there is a federal maximum amount that you could earn, but the amount that you earn is going to depend on how much you have paid into the Social Security retirement system. I believe the federal maximum amount in 2025 is $4,000 or $4,018. There is a 5-month waiting period with SSDI, and similar in a way to SSI being linked to Medicaid, SSDI is linked to accessing Medicare, but you do have to be receiving SSDI benefits for 24 months before you get access to Medicare, where with SSI, you get access to Medicaid basically right away. So this is just a little overview of the differences between them. Just remember, though, SSI and SSDI are both run through the Social Security Administration. Both are considered long-term disability insurance programs, and both have the same definition of disability. There is just a summary of some differences, like the maximum monthly benefit amount, who gets eligible for either of these programs, and the 2 different health insurances that they're linked to. So I do just briefly want to talk about the application process for SSDI. And when we talk to individuals about SSDI and whether they qualify, one of our first questions, or at least my first question, is, do you have a My Social Security account? This is probably one of the quickest ways to see if you have the work history that qualifies you for SSDI benefits. So when you log into this account, you can see right on top this like green bar on it. And if it is green, that means you do have the work history needed to qualify for SSDI. Remember, you still have to meet the definition of disability, but you at least know that you have the work history requirement met. And you will also see what your estimated monthly benefit is. So this is a really great way to know, or to at least have this information to plan for whether or not you do want to apply and to plan for the future as it comes to finances. This My Social Security account is also where you can apply for SSDI and track the progress of your application. So I have been throwing some terms around with SSDI, so I do want to go over them just to make sure we clearly understand them. If you get approved for disability or for SSDI, they're going to give you what is a disability onset date. And this is the date that the Social Security Administration gives as the date your disability began. This is most likely not going to be the date that you are first diagnosed, but the date that your disability prevents you from being able to work. Then there is this 5-month waiting period. And this period will start from your disability onset date and run for 5 full months. During this period, you are not going to be receiving any type of SSDI benefit payments. And then lastly, there is your entitlement date. This is the first day that you are eligible for cash SSDI benefits. And this will be right after your 5-month waiting period ends. So that is just important to know. And this will all be provided to you if you get an award letter from the Social Security Administration. Now, the question sometimes becomes to, well, how do I figure out if I qualify for any type of like maybe back pay or retroactive pay, and for how long? And I just want to go over what back pay and retroactive pay actually is. Back pay is the months between application and approval. And the Social Security Administration will actually pay you for the months. If you are awarded benefits, they're going to pay you for the months for how long it took them for them to actually process your application and get you awarded for benefits. Then they might actually also provide you up to 12 months of retroactive pay. And these are the months that happened before you actually applied for benefits, but were still considered or meet the definition of disability by the Social Security Administration. So these are going to be the months between your disability onset date and the actual time of your application date, minus a 5-month waiting period. They do set a maximum limit to 12 months because the Social Security Administration says it's not their fault it took you too long to apply. So they do put a cap on it. And then the last just key date that I want to say is the Medicare eligibility date, which is 24 months following your entitlement date. So just to walk through an example of the timing of everything, because these terms can be a little bit confusing. So what you see across the bottom of the screen are the months of the year. So starting with March 4th. So I want you all to see Jackson. What you see across the bottom of the screen are the months of the year, starting with March, April, May, June, July. Jackson applies for disability benefits on June 1st, 2021. They gave him a disability onset date of February 28th of 2020. However, the Social Security Administration took a little bit of time and they approved his application on September 1st of 2021. His 5-month waiting period is going to run from March all the way through July. So his entitlement date is actually August 1st of 2020. Is he entitled to some back pay? And yes, he is. He is actually going to be approved for 3 months of back pay, which is how long it took the Social Security Administration to actually approve his application. And then is he entitled to retroactive pay? And he is. He is eligible for at least 10 months of retroactive pay, which are from the date of application back to his entitlement date. And then he is eligible for Medicare 2 years from his entitlement date, so August 1st of 2022. And I just want to go through one more example of Isabel, who is also applying for SSDI. So her disability began October 31st of 2019, but unfortunately she didn't apply for SSDI until June 1st of 2021. Her application was approved on December 31st of 2021, and her 5-month waiting period would be from November 1st of 2019 to March 31st of 2020. Her entitlement date, which is when she's eligible to start receiving benefits, is going to be June 1st of 2020. And the reason why is because you can only have 12 months of retroactive payments. So it's only going to go 12 months back from the date that your application, or from the date that you applied. So in her circumstances, she actually waited, or since she waited so long to apply, she's actually going to miss out on 2 months of benefits that she would have been eligible for, but she just waited too long to apply. And she is going to get some back payments as well. She will get 7 months of back payments from the Social Security Administration, because that's the time that it took for them to actually process her application. And then the Social Security disability benefit system is kind of set up to deny. They even admitted that about 65% of applications are initially denied. And I just want you to know, though, that you do not, like with health insurance, you do not have to take this no as the final answer. There are actually many opportunities to go through the appeals process about this denial. The first is just requesting a reconsideration. You're going back to the Social Security Administration and asking them to reconsider their denial. You can provide additional information like more medical records from doctors, any type of information you think would be helpful on actually getting your benefits approved. And then if that is even still denied, there are other multiple levels of appeal to try and get benefits approved. And I would be happy to talk about the appeals process at any time with anyone. We do have a ton of resources on disability benefits, because I know this was an extremely short period on disability benefits, but we have a lot of information on our website on disability benefits. And then we also do a monthly webinar series that's open to everyone. We cover a variety of topics such as insurance, employment, advocacy, estate planning, and more. We also record all of our webinars, and you can access all of our recordings on our website as well for our past webinars that we've done. And then if you ever have questions about your specific situation, you can also always contact us through our free legal and financial navigation program. You would just have a phone call with one of our staff attorneys who would help provide clarity around the situation, help identify different options and weigh the pros and cons of those, and empower you to take next steps as well. You just go to triagecancer.org/get help and fill out a brief intake form, and then you would schedule a call with us at a time that works best for you.